Today, we're going to take a closer look at a big problem for many people and a very interesting issue, the atlas. The atlas vertebra is the topmost of your spine and can cause a variety of problems in people. It can be shifted, misaligned, blocked, and is the culprit of many problems, such as headaches, migraines, pain in the jaw, shoulder or neck problems, can cause a severe stiff neck, back pain, hip pain, and even pelvic tilt. But it doesn't stop there. Hearing problems, tinnitus, a compromised sense of balance, vertigo, nausea, and loss of concentration are also chalked up to it. My God, all these problems are said to come from this little piece of equipment? This video is going to explain my take on the issue, something only few patients have ever heard of, if at all. And you'll be amazed and relieved. First, let's have a look at what we're talking about here. This is your cervical spine, 7 vertebrae, and the little one at the top, this little one here is called atlas, and it sits on the axis, the second vertebra underneath it. And of course, these elements are involved in your head's movements. When you turn your head or nod it forward or backward, this structure is involved in all these movements. But as is always the case with your spine, there are a lot of ligaments, muscles, fascia that surround and stabilize everything and make sure above all that you can move. That means everything is interlocked, meshed, so that nothing operates independently, and that, by the way, holds true for your entire body. We have a holistic, functioning body. And that means everything that performs a function is tied into other functions. Everything is linked to everything else. And at the same time, and that's something that makes absolute common sense, the closer certain areas, structures are to one another, the more their functions are linked up. The more distant they are from each other, the weaker the link is. What does that mean if you spell it out? If you have tension developing here, the adjacent area will be affected by that. And if you relax an area, the adjacent region will relax as well. That relationship alone gives rise to the question if it is really possible that such a small structure, such a small region, can have such a massive impact to cause, let me say, severe complications in remote places, but at the same time, leave the surrounding areas unscathed. So what's my point here? My point is that if we approach this issue from a functional perspective and say, okay, the head, the cervical spine, the upper body are involved in movements, and this structure enables you to make certain movements, such as nodding your head alone or with your cervical spine, bending your head backwards, with or without your cervical spine, tilting left or right, and, of course, rotating your head with all the angles in between. Whenever you move your head or neck in all the possible angles of their ranges of motion, then one side of the structure that is performing this task is shortened. A muscle contracts, and the other side of the structure yields. This principle applies everywhere in your body, and so it does here as well. Then this entire area will either be functional or dysfunctional. It works fine or it doesn't. So we have a number of possibilities how a blockage or a misalignment of the atlas or the adjacent structures can develop. The most common contributing factor is a lack of movement. Now, let's ponder this for a moment. How often do we move our head? We turn to the left when we're backing the car out of a parking spot or when we look at somebody standing behind us, but often we rotate our entire torso to do that. Lateral movements, I dare say, almost never happen, and nodding forward or bending backwards, forward to look at something down on the floor, or bending backwards as if you were painting a ceiling, are more the exception. And that means the most common factor contributing to excess tension or blockages is lack of movement. A brief aside. A blockage is not something that happens out of the blue, or something snaps or something mechanical blocks you. A blockage in your body, your joints, or in your spine is defined as a situation where certain muscles, fascia, are pulling so hard that you cannot perform certain movements anymore. It is always something that can be dissolved. The muscles and fascia simply have to be made flexible again. Another factor can be an accident, maybe even as early as during birth. For example, if the pull on the baby's head is too much, or something else goes wrong, this is where tensions and yanking might occur during birth, triggering tensions as the body's response. And of course, whiplash in a car accident. All these things can be the cause for these issues. But be that as it may, the fact is you have this tension in there, either caused by a lack of movement and resulting in tension and stiffness, or through an accident. Somewhere something is not flexible and doesn't yield. A vertebra is being pulled into a position where it is not supposed to be. Something is out of whack. And when something is out of whack, misaligned in this area, then the entire area is out of whack. And it would make no anatomical sense. When something at your atlas becomes stiff, is blocked, and everything else around it is problem-free. There is no logic to that. And I say this idea doesn't rhyme with reality. But what do these thoughts mean, actually? It means that this is something that we have seen in real life for years now, that if there are problems, the entire area has to be normalized again. Let's start with headaches and migraines. Headaches and migraines are mostly connected with this area being completely tensed up. The forces acting here are excessive, and if you relax this area, you can get rid of your headaches, even migraines. The neurologists among you should not pay too much attention right now because they have a completely different theory about migraines. But as a quick comment on my part, for me, a migraine is nothing other than a rather intense headache. There is tension. There is pain. The headache, that is. There is excruciating pain, and that is the migraine. And you find that everywhere in your body. There's light back pain, a more severe pain, and there's lumbago. You have discomfort in your shoulder, ranging from a light pain up to a frozen shoulder, immobilizing you. For me, that's the same pattern. Maybe it's hard for you as a neurologist to follow this argument, but it makes for an interesting debate, and I, for my part, stick to the real world. We can help people with migraines using this approach, and I think there has to be something to it. Now, let's talk neck pain and pain in your jaw. Neck is closely related to headaches. Purely from a functional perspective, it's always about various myofascial trains. In one instance, your body triggers a headache because it wants to prevent something that might damage the structure. Or in another instance, it sends you neck pain. The objective is always the same, preventing worse things from happening, like damage to the structure. We're talking about 95% of all pain in our experience. Basically, the lion's share of those problems. Jaw pain, too, is mostly homemade because if these muscles running here are connected to the temporal muscles, the chewing or masticatory muscle, then, of course, the mandibular joint, which is an integral part of this movement, starts hurting as well. Or the surrounding area, or pain radiates from the temple down. There are so many types of pain your body sends out to protect itself. And you can put a stop to this by simply relaxing the muscles and making the fascia flexible again. It's the same case with your shoulder problem. If your entire neck is tensed up, your muscles are too short, stressed out. And also, the muscles that run down to the shoulder that are partially intertwined with other muscles, then, of course, your shoulder is somehow affected by this. Let's go one floor downstairs. Lower back pain, hip pain, pelvic tilt. These are familiar problems. These are things we treat. We try to stop. For pelvic tilt, we have one exercise where you can correct such a pelvis by 1 to 2 centimeters with an exercise of 1 to 2 minutes. These are situations we can easily improve. We don't have to involve the atlas to do that. What else do we have on the list? Hearing problems and tinnitus. They are connected to this tensed-up situation around the cervical spine. And if you also consider the muscles involved in mastication, the chewing motion of your jaw, you see the inner ear is close by. And the fact that the mandibular joint is only millimeters away from the ear, then of course, if things are shifted here, it might impact your hearing. It doesn't have to be a loss of hearing or tinnitus, but changes in your hearing. We've seen such symptoms, but as I said, to be clear, it is always, or in most cases, about an increase in tension to a point where your body responds with blocking, with pain, with discomfort, and such things. My impression is, let's start up here again. Well, my impression is that regarding headaches, no one really knows what causes them. For migraines, there are therapies and theories, but they don't work consistently, and pain, up here and down here, often occurs without any noticeable structural changes. This is the old medical opinion, the conventional position on this, and if you can't find anything in the hip joint, if there's no sign of arthrosis, no slipped disc here, and so on, then the atlas joint is a perfect candidate for such a remote effect to, let me put it like this, it sounds a bit negative, to simply claim that this is the case, because that would solve the problem of explaining the cause. The atlas is to blame, case closed. But that doesn't match up well with experience with special atlas therapies that only treat this confined area. They might work occasionally, studies say about 20%, the other 80% show no effect, and that is not a good track record to support the theory of the remote atlas being responsible for all this. And this is why my suggestion is to be pragmatic in our approach. So, if you have a headache, just relax the area around here. With some of our exercises or our osteopressure technique, we teach you to treat yourselves, to press the relevant points yourselves, and then you'll notice how your headaches subside or even disappear. The same goes for migraines. If you're not confident enough to do that yourself, go and visit one of our therapists. They'll show you what works and how it works. If you have shoulder pain, take care of your shoulder, then your pain will vanish. If your back hurts, do the same. Take care of it. Do the appropriate exercises or have yourself treated with osteopressure and your pain will be history. The same procedure for your hip pain. That means learn the language of your body. Listen carefully to what your body is telling you. And if it tells you, I have a hip problem, I believe it is more conducive to a solution to simply listen. Something is wrong with my hip. Let me check if I could do something to help the situation, no matter what might or might not be wrong with your atlas. Studies on the atlas joint reveal that about approximately, the correct number escapes me right now, and I don't want to give wrong numbers in this video, but I remember that a high percentage of those examined who had no complaints whatsoever had a misaligned atlas vertebra. And that proves to me that there is no immediate connection. And that's why I say be pragmatic. If you want these upper vertebrae near the atlas joint, the structures here to be well aligned, in good condition, so that everything is as it should be, that the ligaments have the proper flexibility, that the fascia is in top shape, then do the exercises meant for this part of your body. And we also have exercises designed to go deep in here where you could feel something is shortened and there. So please approach the problem pragmatically and do these exercises, gain flexibility there, and then any misaligned vertebrae, the atlas maybe, it doesn't matter, will go back to its normal position. Because what you should know is the positioning, the alignment of your bones, is achieved by way of a positive locking mechanism. This is an engineering term. If I have a finger hooked up like this, it is locked in place by the nature of its shape. That's what the term means. And there are small, positive locks in your cervical spine. Even your hip is not a perfect lock design. There's still some slackness to allow moving out of the normal position without you noticing it. Most people's hips are slightly misaligned by the pull of muscles and fascia. And even if you could get to this, you can't reach it anyway. It sits in there way too deep. But if you could get to this and rearrange the atlas or any other vertebrae, it would only stay like this briefly anyway, because the muscles and fascia would continue to pull on them. And that means the changes would only be temporary. And you would still have to use exercise to normalize the tensions of your fascia and muscles so that everything stays in place in the long run. So, if you want to go down our path, which means relaxing your muscles here as a precondition for a self-induced realignment carried out by your own body, or you take the other path, having it snapped into place forcefully with a cracking sound, I'd advise against that. There are vessels that run through the vertebral bodies. Nasty things have happened with this, but theoretically, you can pick either path, but in real life, I would pick our path. But no matter what you do, you still have to do these exercises anyways to bring your muscles and fascia connected to the structure back to their normal pull, flexibility, so that the realignment happens in a biological fashion and not through brute force from the outside. So if you have problems and pain here in your neck, then do our exercises. You can find plenty of them on YouTube. You're here anyway. And go to our L&B Premium channel by clicking here. Do the exercises, gain experience, find out what works for you, and your atlas will be relaxed, unblocked as well, and everything can get back to normal. If you click down here, you can subscribe to our channel, and I would ask you to do that so you don't miss out on any videos. And another big ask, share this video as often as you can so that people learn about this and then can decide for themselves what is right for them. Bye, and see you soon.